and welcome to this edition of the France 24 interview. I'm joined by Dr. Julien Cavanagh, who's a neurologist at SUNY Downstate Medical Center in Brooklyn, here in New York. Thank you very much for being with us here on France 24.
Thanks for having me.
First of all, thank you for the work that you and your colleagues are doing. Please, can you start by telling us how things are looking here at your hospital? What's the situation right now?
We're still facing a health disaster today. Obviously, social distancing, stay-at-home orders, they do work. We have seen a reduction in the number of patients presenting to the emergency room, but we are still facing a lot of patients admitted to the hospital. Behind those walls, on this medical campus, you have 500 inpatients sick with the coronavirus. That means that we still need time to take care of those patients, and that still means we are in full crisis mode.
Can you describe what your daily routine is like when you arrive at work? What happens? How does it feel for you when you walk into the Covid-19 ward?
First, the entire organization of the hospital has changed. This means that we all became Covid-19 doctors, Covid-19 nurses. You enter the units, and most of these rooms are closed to limit the spread of the virus. But then, really, what is striking is the amount of suffering that is in those units. These patients are gasping for air. These patients are extremely short of breath. And a lot of them have a hard time tolerating the measures that we have to do to help them. The supplemental oxygen, the positive pressure. They get agitated. You can tell how miserable, how much suffering there is in those units.
How difficult has that been for you as a doctor?
It's been really difficult. You're used to have things to offer to patients to make them better. You're used to have treatment, and we're facing a new virus. We have supportive treatment to offer to those patients. We don't have a silver bullet. We don't have a medication that's going to make the virus go away.
The people who are coming in with the virus are not only presenting with lung problems, but also with multiple organ failure.
When we read the series from China and from Italy prior to the epidemic arriving in the United States, we read the descriptions of those viral pneumonia and those hypoxic respiratory failures. And those turned out to be accurate descriptions. But what we also realized was that COVID-19 was also a renal disease. We see acute kidney failure. It was also a neurologic disease. We've all heard about people losing the ability to smell. That's the virus attacking the olfactory nerve. But we've seen massive strokes. We've seen cerebral hemorrhages. We have seen cerebral edema. We think that this virus causes coagulation disorders, which is probably underlying a lot of the disorders it causes. We're learning a lot about this virus, and we keep searching.
What do you have to say to protesters who are gathering at state capitals calling for an end to the confinement orders?
I don't know that I really have much to say to them. It seems that it's really hard to engage in a dialogue with people who don't really live in a world where facts and science mean something. All I hope for them is that reality doesn't catch up with them. And unfortunately, it's very possible that some of these protesters will be infected in the demonstrations where they went and will in turn infect some of their family members. I find it very sad.
What do you make of the way that the Trump administration has dealt with this crisis from the start?
The federal government has failed us. First off, by ignoring the signals that this was going to be a pandemic of biblical proportions. Then by the failure of the testing policy and the supply chain for medical supplies. And even today, you hear denial or minimization from the part of the White House. This is very disheartening because the reality of this virus, the reality of this epidemic is a concrete reality every day.
Have you had access to the protective equipment that you need to treat COVID-19 patients?
From the very beginning, we started reusing supplies that normally are disposable. We started sanitizing masks with techniques that had never really been researched. And we've done okay with the N95 mask and with the surgical masks and with the goggles. But we ran out of gowns. So last week in this institution, we had to become creative. And we started using those rain ponchos, which are normally used in sporting events and are not designed for medical use. but this is what we have to use as of today. This is kind of a ridiculous example, but it shows how important the supply chain for medical equipment, how critical it was. And we all realized that these equipments are made in China. And not only they're all made in China, but they're all stored in China. What I was expecting from the federal administration was to go to Asia, secure the supply chains, centralize them, and distribute these equipments to the hospitals and the healthcare workers that needed them. What happened instead is everybody bidding against everybody, states, hospitals, even within departments. And what happened is healthcare workers did not get the supplies they needed, and this had an impact on patients.
The virus has not been a great equaliser. It has exposed deep inequalities in this country, mostly because African-Americans and Latinos have been disproportionately affected by the coronavirus.
Because those communities are disadvantaged. They are more likely to live below the poverty level. If you are living under the poverty level, you are living in a smaller house or a smaller apartment. This means that you're not able to social distance. If you have 5 people in a 1-bedroom, how can you self-isolate? Also, that's because these communities are often the ones that keep working even during the stay-at-home orders. They are your delivery people. They are your supermarket or pharmacy attendants who are still on the front line as essential workers. But also, these communities are impacted greatly by other comorbidities. They are the victims of obesity, uncontrolled diabetes, uncontrolled hypertension. And these diseases make them at a higher risk of catching a very severe case of COVID-19 and, consequently, to die from the disease, much more likely that populations are more affluent. And so we've noticed that in this institution, which welcomes communities, Afro-Caribbean communities, which are at this disadvantage, and we've noticed that our mortality rate was much higher, all the way up to 20%. And we compared ourselves to other centers in the United States who serve similar population with similar demographics, and the numbers are the same.
What happens for people who come in and who don't have healthcare coverage at your hospital?
This institution welcomes absolutely everyone, regardless of their ability to pay, their immigration status. This is our pride to welcome everyone. But many people are underinsured or have no insurance at all. Our social workers do wonders. There are ways to get these people insured. The U.S. Congress passed a law, the CARE Act, which guarantees that the care for COVID-19 will be paid by insurance companies. But you see how complicated this whole system is. And it's not just about having the system, it's about having the population understand it. And we think that a lot of people do delay their care because they're concerned about receiving the bill down the road.
Can you tell me about your personal experiences? How has your home life been? Have you been isolating? Have you been afraid for your own life at any point?
You finish a day of work at this hospital and you leave it, and you've been exposed despite all the personal protective equipment. And you're thinking not about if you're going to get the virus, but rather when you're going to get it. And how sick am I going to be? And am I sick right now? And am I a healthy carrier? It's not only doctors isolating, it's also nurses. I've heard of nurses living in their basements. I have isolated from my family because I'm afraid that I will give them the virus if I'm a healthy carrier. We have hope that in the near future, we'll have an antibody test that will be able to predict if we are immune from the virus, but we don't know yet how efficient a strategy that is. So the question remains, how long do we have to isolate?
Are there any particular patients who you've treated who will just stay in your mind forever?
Last week, one of my patients passed away. The family was very disheartened, and they really wanted to have one last moment with her. I went into the room with a phone, and I put them on speaker. The whole family was there, and they said one last prayer for her, and just a few hours later, she passed away. I think I remember that.
When do you process what you've witnessed during a day at work?
We try to talk among each other. We have Zoom meetings where we all share our experience. The mental health professionals here on campus have been outstanding, offering all the mental health we need. I think it's going to take us a long time to process this. I think there's something very similar to what veterans of war experience. Sometimes you feel that only somebody else who is on the front line is going to be able to understand your experience with these patients in those COVID-19 wards.
Could you ever have imagined previously something like this happening?
The idea of a pandemic is nothing new. What we did not expect is the federal government ignoring the signals. What we did not expect is the White House being in denial. What we did not expect is the failure of testing. What we did not expect was the collapse of the supply chain. And what we did not expect is all these chaos. And in that respect, the White House made itself guilty of public health malpractice. History will most likely remember that this caused many American lives. The healthcare system is a critical asset. It's something that is not a cost, but something that is a wealth, something that is an asset for the entire community to take advantage of. I hope at the end of this crisis, everybody understands that and we gain the respect that other beautiful institutions like our military in this country do take advantage of.
Are you concerned about a second wave here in New York that could potentially be even worse than this one?
Not only we're concerned, but we prepare for it. We know that if social distancing and stay-at-home orders are relaxed too soon and too quickly, there will be a second wave. So we remain in crisis mode. We want to keep the ability to open a very large number of beds very quickly and to staff them appropriately. We're also very concerned that come fall and winter, this epidemic would collide with the seasonal flu epidemic. And this catastrophe could be even worse than the ones that we just experienced.
Thanks very much for joining us here on the France 24 interview, Dr. Julien Cavanagh, and thank you very much for the work that you're doing. You've been watching the France 24 interview. Do stay tuned.
Yo, what's up? This is Will I Am.
Apple. Yo, what's up? This is Apple the app.
And we're the Black Eyed Peas, and you're watching France 24, and we're here to talk about Mamacita and how we are all living in quarantine.
Encore on France 24 and France24.com.